Tuberculosis, or TB for short, is a serious illness that affects millions of people worldwide. It's been around for centuries, affecting people all over the world, regardless of age, gender, or nationality. TB is caused by a tiny germ, a bacterium called Mycobacterium tuberculosis, that spreads from person to person through the air when someone with active TB coughs, sneezes, or even talks. This bacterium loves to live in the lungs, where it can cause severe respiratory issues, but it can also travel to other parts of the body, causing problems there too, such as in the kidneys, spine, and brain. Imagine a tiny seed landing in a garden. Just like a seed needs the right conditions to grow, the TB bacterium needs the right environment to thrive. That's like the TB bacterium entering your lungs. If it finds the right conditions, it can start to grow and multiply rapidly. If the conditions are right, it can start to grow and multiply, leading to an active TB infection that can be very dangerous if not treated properly. This is how TB infection begins, and it can spread to others if not contained. But don't worry, not everyone who breathes in the TB bacterium will get sick. Many people's immune systems are strong enough to fight off the infection. Our bodies have amazing defense systems, like little soldiers protecting a castle, ready to fight off invaders. These defenses often fight off the TB bacterium, stopping it from causing any harm and keeping us healthy. But sometimes the bacterium can hide in our bodies, staying quiet for years without causing any symptoms. This hidden infection is called latent TB. People with latent TB don't feel sick and can't spread the disease to others. It's like a sleeping dragon, not causing any trouble but still there, waiting for the right moment to wake up. Understanding TB and how it works is the first step in protecting ourselves and others from this potentially dangerous disease. By raising awareness and promoting prevention, we can help reduce the impact of TB worldwide. Let's take a closer look at what happens when TB takes hold in the lungs. Tuberculosis, or TB, is a serious infectious disease that primarily affects the lungs, but it can also spread to other parts of the body. Imagine your lungs like two big balloons, filling with air every time you breathe. These balloons are essential for bringing oxygen into your body and expelling carbon dioxide. Inside these balloons are tiny air sacs, like little clusters of grapes. These air sacs, known as alveoli, are where the magic of gas exchange happens. This is where oxygen from the air enters your blood and carbon dioxide leaves your body. The alveoli are crucial for maintaining the balance of gases in your bloodstream. When the TB bacterium settles in these air sacs, it can cause inflammation and damage. The bacteria multiply and create an infection that disrupts normal lung function. It's like the air sacs get irritated and swollen, making it harder for them to do their job. This inflammation can lead to a persistent cough, chest pain, and difficulty breathing. Over time, this damage can create holes or cavities in the lungs, further affecting their ability to function properly. These cavities can become breeding grounds for more bacteria, worsening the infection. Think of it like this: if your lungs are like a highway system, transporting oxygen throughout your body, TB is like a traffic jam. The bacteria block the smooth flow of oxygen, causing congestion and inefficiency. It disrupts the smooth flow, making it harder for your body to get the oxygen it needs. This disruption can lead to fatigue, weakness, and a general feeling of being unwell. This is why people with active TB often experience shortness of breath, especially during physical activity. The reduced lung capacity makes it challenging to perform everyday tasks. Their bodies have to work harder to get enough oxygen. This extra effort can be exhausting and can significantly impact their quality of life. Understanding how TB affects the lungs helps us appreciate the importance of early detection and treatment to prevent long-term damage. Early intervention can save lives and reduce the spread of this infectious disease. Now that we know how TB affects the body, let's talk about how it spreads. TB is an airborne disease, which means it travels through the air, much like the common cold or the flu. When a person with active TB coughs, sneezes, speaks, or even sings, they release tiny droplets of saliva or mucus into the air. These droplets carry the TB bacterium. If a healthy person breathes in these infected droplets, they can become infected with TB. Think of it like this: imagine someone blowing bubbles filled with tiny, invisible TB bacteria. If you're close enough to breathe in those bubbles, you could inhale the bacteria. The good news is that TB is not as contagious as some other airborne diseases. It usually takes prolonged close contact with an infected person to transmit the bacteria. casual contact, like passing someone on the street or sharing a meal, is unlikely to spread TB. However, it's important to remember that people with latent TB are not contagious. They cannot spread the bacteria to others. Section 4, Silent Threat versus Active Illness. Latent TB and Active TB. We've mentioned latent TB and active TB, but what's the difference between the two? Understanding this distinction is crucial for both patients and healthcare providers. Think of it like this. Latent TB is like a sleeping dragon. It's there, but it's not causing any trouble. It's present in the body, but not causing any harm. The bacteria are dormant, lying in wait. The TB bacteria is dormant, kept in check by the body's immune system. This means the immune system is actively preventing the bacteria from multiplying. People with latent TB don't have any symptoms and cannot spread the infection to others. They live their lives normally, often unaware they carry the bacteria. Active TB, on the other hand, is like the dragon awakening. The bacteria become active and start to multiply. The TB bacteria is active and multiplying, causing damage to the lungs and potentially other parts of the body. This can lead to serious health issues if not treated promptly. People with active TB experience symptoms, such as coughing, chest pain, and fatigue, and they can spread the bacteria to others. This makes it a public health concern. The good news is that latent TB can often be treated to prevent it from progressing to active TB. Early intervention is key. This is why testing and treatment of latent TB are crucial, especially for people at higher risk of developing active TB, such as those with weakened immune systems. Regular checkups and adherence to treatment can make a significant difference. Understanding the difference between latent TB and active TB is essential for effective prevention and control of this disease. By spreading awareness and ensuring proper treatment, we can combat the spread of TB and protect public health. Section 5. Recognizing the enemy, symptoms of active TB. Now that we know how TB spreads and the difference between latent and active TB, let's talk about the symptoms of active TB. Remember, people with latent TB do not experience any symptoms. Active TB, on the other hand, can manifest in a variety of ways. The most common symptom is a persistent cough that lasts for more than 3 weeks and may produce phlegm, sometimes tinged with blood. Other symptoms include chest pain, weakness or fatigue, loss of appetite and weight loss, chills and fever, and night sweats. It's important to note that these symptoms can also be caused by other medical conditions. Therefore, it's crucial to see a doctor if you experience any of these symptoms, especially if you've been in close contact with someone with TB. Early diagnosis and treatment are essential for preventing the spread of TB and improving outcomes for those infected. Remember, TB is a treatable disease, and seeking medical attention promptly can make a significant difference in your recovery.